Well, howdy. I recently toured another hospital system and got to hear one of their presentations on physician burnout, which is a subject I take very seriously. It's certainly something that's affecting our profession very deeply, and it pains me to see my colleagues, some of them, facing burnout, and I want to do everything we can to help those that are experiencing burnout. But it bothered me a little bit that this whole talk didn't really address any of the issues that I think are causing burnout, and it's the fact that we feel helpless against this mountain of bureaucracy, the fact that we have to deal with prior authorizations. We have so many folks from the C-suite sometimes pressing down upon us. We are often rewarded in an RVU system that doesn't seem to reward necessarily the best physicians and those that give the best patient care at all times. I think if you took a physician from 1990 and plopped them down in 2025, they would realize that being a physician has so many more administrative burdens than it used to, that that's what's causing, I think, burnout, is this hopelessness against this bureaucratic and sea of red tape that we have to cut through just to try and treat patients these days. And so it's something we do need to address burnout, but let's not miss the forest through the trees, and that let's just don't have a seminar on burnout and finding outside activities and enjoying what we do. Let's try and fight against the things that are causing this burnout in the first place. The AMA has recently done a survey, and it shows that at least some of the numbers are trending in the right direction. The number of physicians who are considering leaving the profession in the next 2 years is down now to about 32% from a high during COVID. The number of physicians that have experienced at least one aspect of burnout is down. And those that would say their job has too high a level of stress is also down. They've also published the top 10 specialties that have the least amount of burnout and the top 10 specialties that have the most amount of burnout. But one thing I can always say is, if you are feeling some of those symptoms, get involved. Be a part of your county medical society. Be a part of your state medical association. Do something to try and combat the bureaucracy and the red tape and all of the forces that make our job so difficult. Fight it. That's one of the best things there is for burnout, is be involved. See what's going on in your local politics to try and make the lives of patients and physicians better. And I'll tell you, that really does help burnout. When you feel like you're doing something and you're working towards trying to find solutions to all the vexing problems that plague us, do something about it. And I guarantee you, among other things, and you should do other things, that will help.